Good day everyone. I am Professor Dr. Shivani Mojumdar, Professor and Head of the JMN Medical College, ex-Professor and Head of the Calcutta National Medical College. Today I shall show you the base of the skull. Now you see this is the whole of the skull and the skull cap is removed, and after removing the skull cap you will see the base of the skull in the inner aspect, and this is the base of the skull in the outer aspect. Now first let's discuss the base of the skull in the inner aspect. Now you will see that there is arrangement of the base of the skull as a three staircase. Now this is the posterior cranial fossa, then you will lift up to the middle cranial fossa, and next you will go to the anterior cranial fossa. So it is divided into three fossae. Now the first fossa, that is the anterior cranial fossa, is formed in front by the orbital plate of the frontal bone, and in the middle you will see the internal frontal crest, and in the midline you will see this is the crista galli of the ethmoid bone. This is the cribriform plate of the ethmoid bone. In this crista galli the anterior end of the falx cerebri is attached. Now through this cribriform plate passes 16 to 20 nerve rootlets of the olfactory nerve, and so that you can perceive the smell, and that will forms ultimately the lesser wing of the sphenoid. You see in the medially it is protruded and forms the anterior clinoid process, and in this anterior clinoid process you will get the attachment of the free end of the tentorium cerebelli. Now next to this anterior cranial fossa and beginning of the middle cranial fossa, you will see two elevation. These are known as the middle crinoid process. Next you will see in front of the middle crinoid process there is a sulcus. This sulcus lodges the sulcus chiasmaticus of the optic nerve, and this is the optic foramen which passes into the orbit. You will see the orbital cavity and comes out. So optic nerve will passes through this foramen. So this is known as the optic canal. Next, behind the middle clinoid process there is a depression. This depression is known as the pituitary fossa. It lodges the pituitary, which is a very small organ, but it has known as the bandmaster of the endocrine orchestra because it controls all the endocrine gland in our body. Next, you will see this is the body of the sphenoid bone. You will see the sphenoid bone is here. So you will get here the body of the sphenoid, and the body of the sphenoid is attached to the greater wing of the sphenoid. At the junction of the body and the greater wing of the sphenoid, and between the lesser wing and the greater wing, will get a oblique foramina. This is known as the superior orbital fissure. Through this superior orbital fissure there is passage of the nerve, that is the third, fourth and sixth nerve, and you will get two ophthalmic vein here. It will process from the brain to the orbital cavity. Next you will see that at the junction of the greater wing with the body there is a foramen. This is known as the foramen rotundum. That means rotunda means a space. So in this space lies the foramen rotundum, through which the maxillary division of the trigeminal nerve passes, and that is purely sensory and supplies some of the portion of the cheek in the face. Next you will get, this is the foramen, this is known as the foramen ovale. Now oval in shape, that is the large foramen through which passes the mandibular division of the trigeminal nerve, and you will see the trigeminal nerve as a ganglion that is known as the sensory ganglion, and that is the trigeminal ganglion. And that trigeminal ganglion, it is situated at the apex of the petrous part of the temporal bone here. So this is the position of the trigeminal ganglia, and through which this maxillary, that is the mandibular division, come here, both the sensory as well as the motor root. The sensory root supplies the angle of the mandible and the chin, and also the region of the upper lip, and that is the mandibular division, the motor root, it supplies all the muscles of mastication. Next you will see behind this sella turcica, you will get a foramen, and this foramen is blocked in your body by means of a cartilage, over which lies that is the internal carotid artery. This is the position of the internal carotid artery. Next you will see here, this is the middle cranial fossa, and you will see this is the middle cranial fossa is limited behind by the petrous part of the temporal bone, and this petrous part, this surface is known as the superior border, not surface, the superior border, where lies the superior petrosal sinus, and behind that you will see there is a big foramina, and this foramina sometimes guarded by lip. Here on the right side there is lip, but on the left side there is no lip. So this is the internal auditory meatus through which the facial nerve and the vestibulocochlear nerve passes, and you will see behind that there is a big foramina, and this foramina is known as the jugular foramen. It is formed by the inferior border of the petrous part of the temporal bone and by the jugular notch of this occipital bone. And through this jugular foramina, the transverse sinus right forms the right sigmoid sinus, and ultimately it comes out as an internal jugular vein. So I will show you how the right transverse sinus forms the internal jugular vein. So this is the sinus, and the veins are coming out in this. And this internal jugular vein, it lies in the carotid sheath in the neck. So you will see, other from this there are different nerves. That means the 9th, 10th and 11th cranial nerve passes through this jugular foramen. Next you will see that this is the big foramen. This is known as the foramen magnum. Now there are small structure passing in front, that is the anterior compartment of the foramen magnum, but you should remember that the lower part of the medulla is the content of the foramen magnum, so that when is there any tumor in the medulla, that will compresses the center, that is the vomiting center, respiratory centers, and the people will die, ultimately the paralysis of all this center. So this is the foramen magnum. In front of the foramen magnum you will see this plane is known as the clivus or slope, formed by the basisphenoid and the basi-occiput. Here it is fused, so the bones become the age above 25. Next you will see here, this is the middle cranial fossa, and in the side you will get the branches, that is like the branches of a tree, and that is nothing but the middle meningeal artery, which coming out from the foramen spinosum, and they forms the anterior division and the posterior division. So this is about the middle cranial fossa. Next, the posterior cranial fossa, you will see that there are some depression. The upper depression is triangular and the lower depression is quadrangular. So in this triangular depression, you will get the lodgement of the posterior part of the brain, that is the occipital pole of the cerebral hemisphere, and in this occipital pole there is you see the visual area is situated. Now this is the middle portion, there is an elevation, this is known as the confluence of sinus, and this confluence of sinus, it directed laterally on the both sides, and in the lower part there is an elevation known as the internal occipital crest, which divides into two and encloses a fossa that is known as the Foramina fossa. And this Foramina fossa lodges the inferior vermis of the cerebellum. Next, you will see, I can mark you prominent the transverse sinus, the right one. You will see the right transverse sinus here, the prominent. You see, this is the right transverse sinus, continued as the sigmoid sinus, and then it goes to the internal jugular vein. And this sigmoid sinus lies behind the ear. So during the operation of the ear, sometimes the ENT surgeon may block this sigmoid sinus and there will be the alarming hemorrhage. Next, you will see here the Foramina fossa, you will see, and you see this is the cut end of the the cut end of the skull, and in this cut end you will see this is the outer table of the skull, this is the inner table of the skull, and the midline there is the diploid tissue. So thank you everyone for watching this video.